I'm Kaya Dickey.
I'm Kayla Callaham.
I'm Aniya-Raye.
And I'm Demi Bernard.
And this is our interpersonal communication group project. Our field of choice is speech language pathology, and we are focusing on learning disabilities. Learning disabilities can affect reading and speaking, and our health disparity is people with developmental disabilities are 3 to 5 times more likely to demonstrate challenging behavior. Government research has shown that improving surveillance and mixed methods can reduce the health disparity.
It is known that there are tons and tons of inequalities within many different communities. Specifically within our field of choice, I researched that people are quick to put minorities with learning disabilities in special ed rooms without proper treatment. There are factors and situations that contribute to this, and those include poverty, decrease in healthcare, physiological facts, the fact that healthcare professionals aren't treating their patients with the right care, and so many other factors.
Noise is a major contributor to health disparities. Noise is anything that interferes with the accurate transmission or reception of a message. It's important to refer to the linear model of communication to see where noise interrupts the message. As you can see in that middle bit, that's where your noise would be interrupting the message going from the sender to the receiver. There are 4 types of noise, the first being physical, any external disturbance that disrupts the meaning between sender and receiver. If somebody with a learning disability has a hard time learning in certain settings because of physical noise, then that could create more accommodations to be met, making it harder for them to receive certain services. And then the second would be physiological, the interference in message reception because of physical, biological, or chemical body functions. A learning disability like dyslexia could create noise that contributes to health disparity. A dyslexic student will require more one-on-one attention and accommodations that could prevent them from receiving adequate care, especially if they're lower income. The third would be psychological, the biases or prejudices of a sender or receiver that interrupts a message. Mental ableism refers to the discrimination against neurodivergent or mentally disabled people. If somebody involved in the treatment or care has a bias against people with learning disabilities, that could affect the quality of the care that the person with learning disabilities receives. The fourth being semantic. Senders and receivers apply different meanings to the same message. Somebody in need of speech services might find it even harder to get care that they need if they have a learning disability that prevents them from properly understanding or speaking language.
Ethnocentrism creates the idea that a group of people is superior to those with learning disabilities. This could allow people to believe just because someone has a learning disability that they are unable to succeed in life. Stereotyping also allows a group to think untrue things about the abilities of those that have learning disabilities. Stereotyping against people with learning disabilities could spread the belief that those with disabilities are not smart.
So what is identity management? It is defined as communication that is used to present oneself, and it includes how others view them. Things such as reading, spelling, writing, math, and even social skills are considered amongst learning disabilities that speech-language pathologists or SLPs typically treat. With identity management, it is important that people identify themselves as having a learning disability. Ideally, identity management isn't used to get rid of learning disabilities, obviously, but it is used as an aid in allowing children and people to feel more confident and comfortable in different learning environments. SLPs typically treat many disorders and provide many different treatments, ranging from something basic like therapy to something more complex. Furthermore, SLPs can provide support for their patients by helping improve vocabulary skills, understanding and improving reading comprehension, and also many more areas of learning.
What does this assignment tell you about health disparities and your role as a professional using effective interpersonal communication skills in the health industry to reduce the health disparity? Discrimination is and continues to be a prominent issue within the Black community as it pertains to those with learning disabilities. Socioeconomic inequalities pertaining to minorities with learning disabilities affect access to proper resources. The 4 noise types serve as serve as contributing factors in a health disparity. Identity management heavily can affect clients' confidence and factors into discrimination. As stated previously, minorities with learning disabilities have in some way faced discrimination, whether that is separation from peers to feeling like they don't belong because of their learning disability. Socioeconomic status affects the resources available to those who need help but don't have access to resources based on things like poverty and lack of education, keeping in mind that clients will be coming from different backgrounds. Psychological, physiological, and semantic noise types are factors to keep in mind when working with clients, making sure the client's needs are being met and not being discriminated against based on the needs of the client. And lastly, identity management, making sure clients are knowledgeable about their disabilities, but also continuing the conversation to make sure that their disability does not define them and treatment or help is not a bad thing or something to be embarrassed by. It's important to celebrate them when achieving goals and reiterating that they are way more than just their disability.
Okay, and these are our references organized by question. Okay, and that was our presentation. Thank you for listening.